Okay, thank you very much for returning to our session today. We are starting with a session entitled Vaccine Intentions of Indigenous Peoples. And so I'd like to first remind the audience that you can ask questions in the Q&A function that's at the bottom of your screen called Q&A. You can also type in the chats function, but we'd appreciate that all questions come through the Q&A function. We have until 2:15 Eastern time, 1:15 Central time to complete this task. So for the next hour, we're going to listen to a short presentation given by a small group of people from the CIHR project, namely Avery Hallberg and Valerie Georges. They're both graduate students at the University of Manitoba, and their presentation will be about 20 minutes long. But what we will follow that with discussion questions from Maria Morrison, who is the director of the Office of the Vice President Indigenous at the University of Manitoba. What we are most interested in this session, however, is to try to get your interpretation of the results about vaccine intentions and vaccine hesitancy, and very much welcome your input, ideas, and even ideas for new questions, because we're still collecting data. So without further ado, I would like to pass the floor along to Valerie. I believe is going to be the person who is starting the presentation. Thank you.
Thank you, Lori. So again, just to start, so my name is Valérie Georges, and this is Avery Hallberg. We are master's students at the University of Manitoba, working on this project along Dr. Lori Wilkinson and Dr. Kiera Ladner on the COVID-19 Social Impacts Network project. So at the center of our anti-oppression practices is necessary to have anti-colonial commitment. This means recognizing that the University of Manitoba and Winnipeg are located on Treaty 1 territory. As students, faculty, and staff live on colonized land with all of the oppressive realities as part of its history and as part of our present. In sharing this research on immigrants, refugees, and individuals without legal status, we as a team acknowledge and recognize the colonial history of this land, now called Canada. It is vital to recognize that as residents of Manitoba, we live on Treaty 1 territory, together with the, Anishinaabe, Cree, Oji-Cree, Dene, and Dakota, Inuit, and Métis people. So this study, which is part of a larger CIHR grant, examines the social and economic outcomes and mental health outcomes of Indigenous people, newcomers, and racialized people in Canada, the US, and Mexico. Today's presentation is focused on Indigenous peoples in Canada. The results we're sharing today are based on a rolling panel internet survey since March 23, 2020. We're also connecting larger monthly surveys. If you have any additional questions pertaining to our methodology, feel free to ask Dr. Lori Wilkinson following this presentation. The pandemic has disproportionately affected Indigenous peoples in Manitoba, who are overrepresented in number of cases, hospitalization, and deaths. As of June 2021, Indigenous people comprise 10% of population, but account for nearly 30% of Manitoba's COVID cases. 46% of Manitoba hospitalization involves Indigenous peoples, and 42% of all admissions in intensive care units are Indigenous peoples, and they also represent 30% of out-of-province ICU patients. In total, Indigenous peoples make up 20% of total deaths in Manitoba. It must also be noted that Canada has unfortunately been very poor in releasing data about the rates of COVID-19 and its effects on Indigenous peoples. There has also been major outbreaks and high-profile cases within Indigenous communities. In 2020, travel from oil lands camps in North Saskatchewan led to an outbreak in 2 Dene communities that have combined populations of nearly 4,000 people and leading to 282 positive cases that account for 7% of the population. Since then, many outbreaks occurred in Indigenous communities across Canada. However, many severe outbreaks recently occurring in Indigenous communities across Canada have not caught the attention of the media, although they have become more frequent and severe. This graph represents vaccine intentions for all Americans and Canadians as of June 21st, 2021. So you'll see here that 7% of Canadians and 22% of Americans are not intending to be vaccinated, while 4% of Canadians and 10% of Americans are undecided. As Avery will soon mention, this group of undecided are those who we should be focusing on. However, rates of vaccinations have increased for both countries, as only 61% of Canadians were administered vaccinations as of November 16th, and the number has now increased to 88%. And in the US, rates of vaccinations have increased from 47 to 68%.
Okay, thank you, Val. So this data essentially asks the question, do you accept vaccines or not? This allows us to see who could be considered anti-vaccine in general and who is particularly concerned about the COVID vaccine specifically. Those in the I don't know category could be those who are specifically worried about the COVID-19 vaccine. This latter group is one that we may be able to convince to take the vaccine if we give them the necessary information. To put our findings about Indigenous peoples into context, let's take a look at the findings about all people in Canada. Men are more likely to believe vaccines are dangerous, while women are more likely to respond, I don't know. Women are more reluctant to accept the safety of the vaccine than men. This could be in part because of the fertility and pregnancy myths that are currently surrounding the vaccine. The reasons for hesitancy are mostly education related. We do not do a good job of teaching vaccine science in public school, and some people are easily convinced by something that they've read on the internet or have heard from family and friends. So first, I will note that we did not have enough Inuit participants to report with accuracy. Second, there's a substantial variation among Indigenous people in Canada. Again, those who responded, I don't know, could be swayed with proper vaccine education or reassurance about its safety. So this slide is looking at vaccine intentions by gender for Indigenous peoples. You will notice that those who responded yes are not included in this graph. This is so we can focus on who has responded no and I don't know. Indigenous males and females are more likely than non-Indigenous people to be unsure if they're willing to get the COVID vaccine. Indigenous women are also more likely than anyone else to respond that they will not get a COVID vaccine. So instead of looking at this as a data set, here's our summary of our findings about vaccine intentions by age and income. Like other ethnicities, Indigenous people are more likely to be open to vaccination as they age, as well as with higher income and education levels. So as you can see, 70.6% of individuals aged 75 or older intend to get vaccinated, compared to 49.2% of individuals between 18 and 24. So data from wave one of our survey showed vaccine intention by news source. Respondents were asked what their main source of information about COVID. The yellow bars are the most interesting to me, as this shows the I don't know responses. As you can see, family, friends, and coworkers can have a strong influence on a respondent's likelihood of receiving a vaccine, as can social media. Those who use traditional media, including radio, television, and print, as well as those who receive their information from provincial or local governments, are more likely to want to get vaccinated. Within the other category, you will find elders, religious leaders, and other sources of information. The majority, 51%, chose traditional media as their main source of information about COVID. And as you can see, the intention to vaccinate is quite high in that category. While the influence of social media can sway those away from being vaccinated, only 17.5% of respondents chose social media as their main source of information. This could suggest that the concern around social media influence could be overblown. It's also important to note that this data came from wave one in December, so it could be interesting to see how and if this influence has changed over time. I would also like to note that we do have data on vaccine hesitancy and TV viewing, whether the person reported CTV, CBC, Global News, Fox News, CNN, etc. But we have not included that in our presentation today. So this slide compares wave 1 and wave 2 data to see how vaccine intentions have risen since December 2020. The I don't knows and knows have seen a downshift, especially the I don't know category. These groups have shifted into the yes, I intend to be vaccinated or have been vaccinated categories. While Indigenous participants are still report lower vaccination intentions than non-Indigenous people, there is still a portion of I don't knows that could be swayed with targeted education. During the survey, those who respond that they do not intend to get vaccinated were asked why they felt this way. This is an open-ended question that allows respondents to place a place to explain why they don't want to be vaccinated. So for a few examples, vaccines in general, I don't have an issue with. This one, however, is experimental and not tested properly. Too rushed, they said. This person could be considered to be open towards vaccines, but have issues with trust in the COVID-19 vaccine specifically. Next, we have do not trust the makers of vaccines or the government. This person seems to be less concerned with trust in the COVID-19 vaccine and more concerned with the pharmaceutical companies and the government. This answer does not surprise me given the history of experimentation on Indigenous peoples by the Canadian government. And then the last one we're going to talk about is I don't believe the hype. And even so, like the flu shot, they're likely infecting us with COVID-19. There's not enough testing done. It's developed way too quick to even find any preventative side effects. So this quote highlights how COVID-19 conspiracy theories or misinformation campaigns have been successful. Many people have compared COVID-19 to the flu, likely due to the influence of some politicians. The second piece of misinformation, is that the vaccine has live virus in it. This is a common concern we've seen among respondents and could be dispelled with educational messaging. So here we have the top 10 reasons for vaccine hesitancy among Indigenous people in Canada from our Wave 2 survey. I coded all the responses into themes to understand where vaccine hesitancy comes from. You could group these reasons further into educational opportunities. For example, with targeted programs looking at how the vaccines were developed, or what health concerns or allergies are at a risk for negative vaccine outcomes. For example, some respondents reported that they were allergic to eggs, and so they could not get a vaccine. You could also do misinformation, myth busting around DNA modification, microchipping, and the like. But that's what I see. So we want to know what you see. What could this data do to help with the current messaging put out by governments? So this is our full research team working on the presentation. Dr. Lori Wilkinson is here, as is Dr. Kiara Ladner. And I'm just going to leave this slide here. I will also note that we are always open to fact sheet ideas. So please follow or visit our website for more information or to contact us. And we also have a Twitter handle that you can follow us for release of our information. And that is it. So I will turn it back to Lori.
Okay, thank you very much, Avery and Val. I'd like to pass the floor to Maria, please.
Hello. I was really interested in a lot of the statistics that you came up with, and in your last list of the top 10, you know, I know you had mentioned it in the anecdote stories, the qualitative statements, but I didn't see it in the list of the government mistrust and kind of, you know, alluding to the historical traumas that First Nation, Inuit, and Métis people have experienced. And I'm just wondering if that is in there, or if perhaps, like I guess that kind of surprised me that wasn't higher.
So for this wave, the trust in government did not make the top 10 for Canada for Indigenous peoples. It did make the top 10 overall, but I was surprised too. And that's why I felt like I wanted to pull that out, because it is still there and it is still a concern. And I do think it's important that it is mentioned.
Okay, good. The other thing that I was curious about too is the education levels of Indigenous participants. Did you code or have that question asked so that you could correlate between what type of maybe messaging that could be needed?
I didn't look at the vaccine hesitancy questions, the open-ended question in terms of education levels, but I certainly could.
Yeah, because I think that would be an interesting correlation, because I think there's some other information, you know, that the higher education levels that you have, you know, and I think a lot of people are aware that First Nation communities, especially rural, like on reserve communities, have lower overall graduation rates and even high school completion. So I think that's where you were talking about the harder to reach in rural communities. Yeah, I think that would be interesting to know. Have you separated out Indigenous people from like rural and city, or like on reserve, off reserve?
Not for the vaccine hesitancy open-ended question, but again, definitely something that I could do.
Yeah, because some of the stories and you know, anecdotes that I've heard of communities is if the chief and councils, if they have strong leadership, that is, you know, many communities were locked down very early on prior to public and provincial guidelines restricted. And because they have sovereignty on their own land, you know, they don't really have to follow the provincial guidelines. And so many of them set up their own roadblocks onto their properties, onto the reserve land, prior to any other kind of initiatives that were going on. And so I think those communities, you know, tried really, really hard in the first and second wave of COVID to really keep a tight handle on the spread. And so perhaps, I don't know, I'm just guessing here too, looking at your information, it just triggered in me, is that because they did such a good job in the first and second wave, right, of keeping it out of communities, that perhaps that they kind of think they don't need the vaccine. Like if there's an avenue of questioning around local government, you know, like if the chiefs and council, I don't know if that would be included in the government communication, like where do you get your news?
I'm not sure if there's a specific, Lori, you might be able to say if there's a specific answer for that.
That's a good question. So we had in the opening keynote speech this morning, Dr. Juliana Reno talked about the issue of, you know, once you have one person in the community with COVID, the spread is inevitable. So he was, just in case for those of you who weren't there, basically travel restrictions usually come too late, that already by the time we know there's a problem, there's already a problem. And so he showed us some evidence to suggest that, you know, once the government becomes aware that travel restrictions are necessary, it's too late because it's already within the community. I actually am following up with Dr. Reno to see what kind of data he may have for various Indigenous communities, to see if that's, you know, how their earlier lockdowns may or may not have prevented further disease spread. But the question of, you know, the belief that my community is locked down and so therefore we don't need vaccinations, I think is a very interesting one too, and I think could plausibly explain some of the hesitancy that we're seeing in the Canadian data, at least amongst some Indigenous people. So we see in our data that in March 2021, amongst Indigenous people, 23% said no, they were not going to take the vaccine. And that's a little bit higher than what we see amongst other people in the Canadian population. You know, again, this is the kind of issue that we'd like to discuss with the audience to get your ideas about what may or may not be happening so that we can start asking different questions as we collect data moving forward.
There's a question there. Maybe, I'm not sure if Avery or Valerie might be able to answer, from JP Unger.
I can't see the question because I've got my screen share on.
Okay, I'll read it to you. So he's saying that he's sorry that they missed the beginning of the presentation, but got to see that a relatively small percentage of people relied on social media as a main source of information. Is there a correlation between those who are vaccine hesitant and those who rely mostly on social media in terms of probably getting the vaccine? Knowing this could be helpful for targeting ads and information. Thank you.
I can go back to that slide because that was covered there. So it does show the vaccine intention by news source. So in terms of social media, as you can see, if they get their news from social media, they are more likely than any other news source to be unsure as if they're going to get a vaccine. They're also 29, almost 30% likely to say no.
Also, with the don't knows are the interesting group. You know, they account for over a third of Indigenous people. And we've been pondering this social media question for a long time because, you know, you see in the news all the time, the media talking about the influence of influencers and people who are trying to disrupt the system. And so you definitely can see through this table with Indigenous peoples that if your main source of news is social media, only a third intend to get vaccinated. But I think there's more to the story than that because people make decisions, big decisions, based on more than just listening to social media, right? They listen to friends and family. Some listen to government, some do not. Some listen to the news, some do not. Some have scientific connections or have scientific knowledge. Others do not. So I think that the social media bit may be a bit overplayed, but at least this data kind of shows that there is a subgroup of people who really rely on what they hear on social media. And so I would advise, you know, governments to start thinking about an educational campaign that they pass on through social media. And I've already talked to the federal government and some of the provincial governments about, you know, this idea, you know, the first ads we saw about getting the vaccine is, oh, if you want to hug your grandma or you want to go to your graduation, you should get a vaccine. Our data actually shows that those people have already been vaccinated. So those messages, they may be important, but they're not resonating with the people, the reasons for people who are not getting vaccinated. So as Maria had said, it could be like if you're living on a reservation that and you feel like you're isolated enough that you don't really need the vaccine. It also could be that the people around you are telling you not to get the vaccine. So I think it's just one piece of the puzzle, to be honest. I don't know if anybody else wants to jump in. Probably not.
There is another question around this. According to the bar chart, you're showing vaccine hesitancy is higher among people whose news source is other. What constitutes other?
So other is it ended up being a very small percentage or a very small number of people, but in other it can be community leaders, band leaders, religious leaders, other sources of information like that.
So people with influential people, right? Your elder, your, if you have a religious leader, that's what the other category is, rather than an actual media source.
The one thing I was going to say about the, I find it interesting that like I actually like the word hesitancy that you have in the study, because it's not an outright no. And the other thing is that elderly people are more likely to get the vaccine. And I think that hesitancy with the younger Indigenous people is it's a real wait and see. And my guess would be that if this data here on this chart was from December.
Yes, in this chart it was December, but I think we've got wave 2 data too, and it's about the same.
Okay, because I would say, you know, the more of the elderly population, their grandmas, their aunties, they all get vaccinated, and the younger people see, and that the family, friends, co-workers, the green bar might go up because they're less hesitant, because they see people and interact with people who have both vaccines, they're double vaccinated, and they're just fine, you know, and that would perhaps, I mean, in small, tight-knit communities, the role models and the people that you interact with in your family are more important to gauge than a celebrity telling you to get a vaccine.
I actually agree with you. I think there's a lot more people taking a wait and see approach, right? They're afraid because the vaccine is so new that they don't want to make a big decision like that until they see if there's people having side effects from that. So I definitely agree with you, and we see that through the population of the study, not just with Indigenous people as well. And I think this speaks to a lot of the misinformation or the lack of education about how vaccines are created and how these vaccines in particular, especially the mRNA vaccines, were created. So these vaccines have been under development since the 1980s. So they're not exactly new. What the trouble with these vaccines were is because they're so unstable, the mRNA vaccines need to be stored in a -80 freezer. They need to be shipped in a special kind of lipid that's very, it's very unstable. Like shaking it is a bad thing. Like you have to, when once it gets to the place where the people are getting vaccinated, the vaccine needs to be mixed with saline and then shaken. So the effect of all of this, right, is that especially for the mRNA vaccines, the reason the technology hasn't been used before is it was just so difficult to get them safely and intact to the places where the people could get vaccinated in the first place. But I don't think any government has done a good enough job to describe why this technology is so difficult, and the fact that this virus is so potentially dangerous to humanity that they had to overcome these problems in order to stop the disease from happening. So I've done this talk with about newcomers, and that's also the very reasoning behind many of them. Their hesitancy to take on the vaccine is they don't understand vaccine science. We haven't given them enough information, and So it becomes a very scary consideration for people.
So there's another question there.
Question is,
Oh,
go ahead.
No, Avery was going to say something.
I was just going to say, just to your point, Maria, if you look at the top 3 reasons for vaccine hesitancy among Indigenous people, it's a wait and see approach, right?
Yeah.
Like they're very unsure, they don't trust it, not sure about long-term side effects, it came out too fast. So all of those things could be said to be a wait and see.
Yeah. Guess that's better than an outright no, but so the other question is from Rosti. How language barriers play in Indigenous vaccine intentions. As an international student, have seen people who do not speak English have a hard time accessing data and science in their language.
So I'm not actually sure, maybe Avery or Lori know about the correlation between the language barrier and Indigenous vaccination hesitancy or intentions, but I 100% believe that. So obviously in Canada, our 2 languages are French and English, but we're omitting and ignoring all the traditional languages that obviously are still relevant today and are still spoken today. So I definitely believe that if the government and other educational materials did focus on giving this information in these languages that so many people around Canada speak, that these first 3 reasons would definitely change and people would be more comfortable or at least know the information that pertains to the vaccines as well.
I think that's correct, Val. I'm more familiar with the newcomer side of the Indigenous, of the vaccination strategy. And we had a lot of discussions about getting vaccination information out in multiple languages. I think that discussion, and probably Kira's better place to answer this question than me, and I'm not sure she's on the call. That discussion is taking place, but I don't see a lot of information. So I'm looking at on the Canada website about vaccine information, and I see that there's not a lot of translations available except in Inuktitut.
I do know that some Indigenous organizations early on, like last year in the pandemic, were putting out posters in multiple Indigenous languages like Ojibwe and Cree, and and they were, like wash your hands, wear a mask, stay safe, kind of that. So they did have some language materials.
And I see some now too in Blackfoot, Ojibwe, some in Cree, some in Michif, Mi'kmaq. So I count about 20 languages, but that doesn't even begin to cover the linguistic diversity of Canada. One of the big issues at the provincial, I think it's a problem that health is a provincial mandate. And the provincial governments wanted exact translations so that they couldn't be blamed for misinformation if the translation wasn't good. So I think that might be a hesitation as well that might be influencing this information. But again, I don't see a lot of good translated information about the vaccine in ways that all Canadians can understand. We're kind of interested to hear from the audience. What do you think about all this? Or should we be asking different questions? Because we have the ability to go out 4 more times, both in Canada, the US, and Mexico, to ask these broader questions. And for the people on the research team who are on this call, we have the ability to run this data for the United States and for Mexico too. Kind of getting to, some dialogue with the audience about what questions we should ask next, how we should be interpreting this, how should we be sharing this data too? So if you want to speak, you can raise your hand, and Chloe will allow you in to speak, so that we can turn this more into a dialogue that goes in both directions. And I can't see anybody at this point, but Mona. Don't be shy.
Mm. While we're waiting for people to get brave enough to ask their question or chime in, I would like to just tell, it just reminded me of a story not too far from here, in Manitoba, in a rural that's close to like 2 or 3 First Nation communities. They had an elder who smudged with sage all of the vaccines, and there was a table at the entrance where, I mean, of course you have to already be there to get a vaccine, but they left with a little pouch of cedar, right? And with the little tag saying in the language that this medicine, goes with the vaccine medicine, and it has been smudged. So I thought that was a really proactive and a really nice touch, because those people could take that little card home saying, I've been vaccinated with this pre-smudged medicine.
That's a good idea. Chloe is gonna allow the person to speak who wants to ask the question orally. I think you can go ahead. I can't see who you are.
Yeah, this is Rusty. Hi team, I have a question. I wonder how vaccine inequality in between Canada, US and Mexico, because definitely Mexico would have less access or less vaccines available for its population compared to Canada and the US. So is there any data on that, and how that reflects on the data and the representation of the sample? So because I see that there's a big difference in between countries when it comes to vaccine access. Yeah, and I missed the beginning of the presentation because of the time difference. So if that's a question that being responded, I'm sorry about that.
Well, that's okay.
I didn't know that it's Eastern time, so I didn't pay attention to the time zone. Yeah.
It's okay. So you asked about vaccine hesitancy in Canada versus the US versus Mexico. You're gonna have to give me a couple minutes to find that data. We have it in short.
Okay.
And I have to dig that up. But I don't know if Valerie or Avery or Maria want to say more about that.
Well, Rusty, I just wanted to ask like a clarity question. You were talking about inequality, and are you talking about vaccine availability to Indigenous communities versus
Yes.
the mainstream population? I'm
Yes.
not a doctor, and I'm not involved in the vaccine research, but from what I know, Indigenous communities, at least here in Manitoba, got kind of first dibs. They got the first allotment, and for the age groups, they were prioritized because information that was coming out was that if it did get in, and when it did get into Indigenous communities, hospitalizations, death rates, and transfer to more contacts, it was a worse outcome. So a lot of the First Nation communities were prioritized and got the vaccine before anybody else. So I would say that the inequality, at least for Indigenous people, wasn't a factor.
So how about when you compare Mexico to Canada, for example? Like, do they have the same? They don't have the same access, right, to the vaccines?
I don't know anything about Mexico. I'll have to let the others chime in.
So that's what I was trying to understand, how that inequality in the vaccine distribution, because Canada is richer and they can buy vaccines like millions of doses, and there are countries like they don't have the access. So if you take Mexico as an example, I wonder how that plays in the indigenous people's access to the vaccines.
That's a good question, Rosti. And so this is an issue that our team is working out at the moment. So although our team is big, the data sets are coming in weekly. And so it's been hard for us to keep on top of everything, but we have a team in Mexico that is preparing this data for the Mexico Indigenous population. And I don't know if anybody is on the line here that can speak to that. Because I haven't been able to check in with them, given all the running around we've been doing here to try to keep the data rolling in. But I see there's another hand up. And so Chloe, I don't know if you want to give that person the microphone.
Yes, hello, can you guys hear me?
Yeah.
Yes.
Hi, so my name is Jervoy, and I guess more of a comment / question. I just wondered about the fact that, you know, most of the information that we've been seeing, and in terms of talking about like access to information to especially newcomers. I'm a social worker and I support like refugee claimants here in BC, and most of the information sometimes we can see is that, you know, the reasons perhaps why you should get the vaccine. But I wanted to backtrack on the comments one of you had made earlier about, you know, the fact that many people think it's like a new thing. However, you said that in the 80s it has been under development. And so how or who really should be responsible for like sort of giving that back end narrative to be like, okay, guys, so this is what's really happening. This is how, because like you said, there hasn't been vaccine education in schools. Even from I think when I was in school, I can't recall getting very deep information about how a vaccine is made, etc., and all of that kind of thing. So how can we really strengthen that? Because again, it really does go back to that educational piece, but also thinking of the fact that many of the individuals which would consider into the racialized group are because they're hesitant because of poor practices in the healthcare system, or, you know, previously there were other experiments done that in the end it was something negative was the result of getting a particular vaccine or just a treatment or anything like that. So how do we really stream that down to really having that background information so people can understand? Because most people assume it's just new and too new, so they're not certain.
That's a great question, Jervoy. And I'll just because it's something that I've been working on. I don't think that many people, you know, people who are immersed in this data and this study all the time, they understand how vaccines work. And I think we've not anticipated the numbers of questions that are coming from anyone about how these vaccines work. And you're right, we do a really bad job of educating people about how vaccines work, if at all.
Yeah.
Until the pandemic happened, I think that a lot of people who were in charge of making the public messaging and the translating of information hadn't given it much thought. I happen to be in a very unique situation. I am married to an organic chemist, and we are close friends with people who are doing mRNA vaccine research. And one of the issues that our friends point out repeatedly, and that happens to my husband as an organic chemist, is the dozens and dozens of phone calls and emails that they've received since the beginning of the pandemic asking them about how do vaccines work? Why are they understanding this scary thing called mRNA technology, why it works, how it works. And so they've been, you know, receiving these calls and emails and answering a lot of questions. We suspect that there's a lot of Canadians who feel the same way, but don't have a way of reaching out. So part of my job or my I guess my pledge, I guess, as part of this project is to try to be that bridge between the scientists and the public health people and the people who are creating all the messaging, that there's a real hole here, that we need to have scientists involved in explaining this. And so there, to a certain extent, this is starting to happen. The problem, I think, going back to Rosti's comments and Maria's comments, right, is trying to make sure that it's translated into the languages that people understand, because it is actually a bit complicated. And trying to distill the information into a way that an average person can understand actually takes a bit of finesse.
Yeah.
But we're, in Manitoba, for instance, with newcomer populations, we just hosted a question and answer session with a physician and with a chemist. And the chemist is charged with, like, how do you do this mRNA research? How do you make it into a vaccine? And how do we make it safe for people? And I think we need to do more of that in different languages, and in different venues too, because not everybody can reach out on Zoom. We know that newcomer population, we know this for the Indigenous peoples too. Like, I mean, many of the, remote reserves don't even have access to decent Wi-Fi. So what are other ways that we can reach out to help people, to educate them, to help them make informed decisions?
I think one suggestion from me would be to have the representation. So, for example, if there's a local community, if there are doctors or, health providers who look like the population, and you help, collaborating with them to then have these workshops in, socially distant, appropriate sessions, then I think that can also help with individuals, seeing that, oh, this is somebody who looks like me. I can ask them questions, because sometimes if they don't feel the trust is there, it's hard for them to really even take the information. So I think it also adds with that trusting and collaborating with local communities or leaders, or even the religious leaders or any other faith-based related things, to help with that educative piece as well.
I agree totally. I know the province of Manitoba has been doing that with different languages in newcomer communities. I think we've been less effective with Indigenous peoples and their communities, but I think part of the problem is there's fewer people to actually help out, because they're so busy trying to do the vaccine rollout itself too. So I think this points to some long-term inequalities that we have to address, like making sure that the people who become experts actually reflect the actual community, because this won't be our last pandemic. And so I couldn't agree with you more, actually. It's yet another inequality that's really hasn't been considered until now. I see another question, I think.
I was just going to comment on that. Here in Manitoba, like having people that look like you talking about the science and stuff. The Assembly of Manitoba Chiefs is a political organization that represents the 64 First Nations in Manitoba. And they have a weekly Facebook Zoom recorded live with Dr. Marsha Anderson and some of their health workers, and they will have youth on, they will have elders on, they answer questions kind of in a format like this, but they're always giving updates to community members, and they have the Grand Chief on as well. And so he takes a very active community-based approach to that as well. And I do know that I tune in because I want to know what's going on, and all of the data and the information is geared specifically to First Nation and Indigenous people. So I think more things like that. But then, like you say, there's a lot of people who are not able to access that, Facebook or Zoom live sessions, and I'm sure they're recorded for later. But there is still that gap in Starlink broadband internet access.
No, that's a great point, Maria. And I think, it really underscores for me too, that we can't just be relying on internet technology to educate people. So, some people they only have a television. So we have to do traditional media. Some people, listen to their elders. And so educating the elders and having them reach out in different ways, I think, is crucial to getting important information out. But I certainly, in the back of my mind, that this pandemic has highlighted inequalities that we hadn't considered or had ignored in the past. I see that there's another question from Mary Claude, and she asks, do you have data on the impacts of COVID-19 on Indigenous people for all the Canadian provinces and territories? Yes, we do. Actually, we've been tracking that data from each provincial database and from the feds. And if yes, will you do comparative studies to understand the differences? And the answer is yes. As soon as we get out of data collection mode. In addition to the survey data that we've talked about here, we're also going out into the field to do qualitative interviews because not everybody can answer a survey. And so in Mexico, the United States, and Canada, we have people who are going out to remote reservations, to remote locales, to people who are not comfortable completing a survey, to do qualitative interviews, but also to gather data. Like, this is rather flat, right? Like, we're kind of guessing when somebody tells us, oh, I'm not going to take the vaccine because I'm too scared about it. These qualitative interviews will allow us to dig deeper into, well, what exactly is it that you're scared about? It may be that they're scared about the sciences being too new, but we can get that in their words. That will also help us to identify ways that we can better educate people and get messages out. I don't know if Val or Avery would like to add to that. Guess not, but yes, we are tracking. We're tracking the actual health data too when we can. I mean, the problem is in Canada, in particular, the Canadian government was so slow to release that data as well. The province of Manitoba has released 10 tables, but they're flat, non-flexible tables, right? You can't manipulate them in any way. So even that data is going to be difficult to dig deeper into, because we have to rely on what's released, and we can't ask our own questions. But yes, it is something on our radar. Are there any other questions? There's a hand up by James Roger. I don't know, Chloe, can you give him the microphone?
Hi there. I'm just wondering if you guys have any data on Indian residential schools and the hesitancy of the Indigenous people from wanting to participate in vaccines. Given the recent events of Kamloops and now Saskatchewan, I'm just wondering if this is something that you've included in your studies. My mother herself went to Indian day school, and I mean, she suffered abuse while she was there. And I'm just wondering if this is something you guys have looked into at all.
I'll let Avery and Val go if they want. Otherwise, I can take this question.
As far as I know, we have not asked about any residential school experience as of yet, but I also do know when looking at our data that we are very much missing a population, because it is 90% off reserve people that are answering the survey. So hopefully through the qualitative side of things, we may be able to dig into those things a little bit more. I don't know if there's anything else Lori wants to add to that though.
So we're not asking about, or we haven't asked about residential school experience, but that doesn't mean we can't, because we still have the opportunity to collect data for another 6 months. I think we've been able to ask recently about, so this is data that's going to be released, I believe, next week, about Canadians in particular, what do you think about who founded our nation? And the answers will disappoint you. Well, I'm not surprised. There's a lot of people don't even know their own history, right? So when asked who founded Canada, still 75% of people indicate that it's some white guy coming over from Europe, right? There's no recognition of Indigenous peoples. I think, as Avery said, we'll be able to get a bit better data from the qualitative studies, but we're able to ask, because we're still in the field, we're able to ask these questions. And I think adding some questions about residential school experience might actually help us with the idea that, you know, past government mistreatment and torture by government officials, medical officials, all of those experiments that Indigenous people experienced in the very recent past. Some of these experiments were continuing into the 1970s. If these are not also reasoning behind not taking the vaccine, we certainly can ask those questions.
James, from one intergenerational residential school survivor to another, I thank you for that question. My grandmother went to residential school where they conducted nutritional experiments and antibiotic and ear infection rates. So there is a high percentage of our community who had hearing loss at a young age, and that's what I think too. I think that, but I think I would tread cautiously on asking questions directly, because so many people, these reasons that you see listed are probably intergenerational residential school survivors, like your dad, your mom, or your grandma, right? It's not that far off in so many First Nation peoples. And I think for me, like I was just thinking about your question, I'm like, what did it for me is I'm double vaccinated, and because of my education, and I was able to read scholarly articles and look at the and I live in a city now where there is good health care, and I have a family doctor. And so all of those factors weighed into my non-hesitancy to get the vaccine. And so I think, and I also know that a lot of our own people and on reserve today don't even really know about residential schools. And they're learning a lot with and along with the rest of Canadians right now, because a lot of people didn't talk about their experiences. And the stories that you might read in the TRC, like the Truth and Reconciliation Commission report, they never shared those even with their kids or their grandkids.
Yeah, I think those are all great points too, but I think also people forget that when the rest of Canadians graduate from grade 12, they graduate with a grade 12 reading level. Whereas when Indigenous, you know, people graduate, they graduate with a grade 6 reading level. So, you know, when I go into these meetings with people and they're like, oh, we can't get the Indigenous people to apply or increase and get our numbers to help have like a reconciliation or an Indigenous lens in our branch, it's like because they're at a grade 6 reading level. So how do you fill out your Walmart, your Tim Hortons, or your McDonald's application if you know, how do you go and read, if that, right? And I just look at this, then there's a huge gap that Canadians don't know about. And, you know, my daughter heard me when I was giving a presentation there to some colleagues, and she had asked me about, why did they do this to Nana? Why did they do this to her? And it's like, you know, my wife and I are trying to decide on, you know, maybe using the children's books to sort of teach her about what happened and sort of talk to her on that level, because I don't feel like scaring her is the right thing to do. I never understood, as when I was growing up, because my father is non-Indigenous and my mother's Indigenous, why my mother always used to say to me, this isn't a great country. And then when Kamloops came out, my mom said she hid the trauma from us because that's what mothers do. And my mother hid this from all the stuff that happened to her, from being raped and beaten and everything that happened to her. And so I think now I'm learning to find my voice, and I'm learning to ask questions, and I'm learning to ask people to have dialogue, because if you sit silence on this, you're contributing to this, right?
Yeah.
And it's just like all the other movements that are going on, Black Lives Matters, and with immigrants coming to Canada. I just feel we need to have more discussions, you know, and so maybe something that you guys want to maybe look into. I know it's probably hard for people to talk about, you know, their experience at residential school, but this could be a big factor as to why they're not getting the vaccine at this point. So I want to thank you for taking my question, and I appreciate you having me today.
Yeah, Miigwech, James, for sharing.
Excellent question. Yes, absolutely something we'll take into consideration. We have another 14 minutes, so don't be shy. If in the audience somebody would like to make suggestions about other questions or other venues of study, I would greatly appreciate that. We may have worn out the audience. There's one hand up. I can't see who it is, but please go ahead.
Hello, can you hear me?
Yeah.
Okay, good. I didn't test my microphone before I came in. Yeah, I was wondering if you were gonna study other effects of the COVID other than vaccination, like on a wider aspect, like a lot of how do you call it, issues emerge or vindication. Oh, I'm sorry for the word, but during COVID happened very important events happened, like recently what was discovered at the residential schools, but the Wet'suwet'en at the beginning of COVID, the Wet'suwet'en demonstrations against pipelines and stuff. And because of the media were so concentrated on COVID, and politicians are so paralyzed at this time, other than, you know, taking care of COVID, nobody can really attend politically to the Indigenous revendication, and nobody can report properly on them. And it's a shame because they're very important issues happening right now. So are you going to try to evaluate the impact of COVID in that way on the political advancement and reconciliation in general? Because so much has happened. Is it clear?
I'll step in too. That's also a great question. And so because our study is ongoing, we've been able to do that. In the summertime of 2020, we started to ask questions about the Black Lives Matter protests, about defunding the police, about anti-Asian discrimination. We're able to do the same here. Because we have the ability for the next 6 months to collect this data and to see if there's a connection, as you say, even a political connection. And already commentators are talking about the political connections between Black Lives Matter protests and the pandemic, just bringing to light the various inequalities that people experience every day. And I don't think it's a coincidence that these events have happened during the pandemic, because it really has brought people together to think about and express their inequalities so that they can talk to people who make the decisions, who ignored them in the past. And I think, you know, the question with residential schools, for instance, this is an opportunity that we can take to also investigate these issues even more as we study the pandemic. I know that the American government has already contacted the Canadian government about doing their own searches at residential schools in the US. So I kind of think, there's already work being done on this, but I think for the research team, certainly there's a way for us to collect data and to make sure that we're responsible for collecting this data, because I think it's happening in tandem. I'm not sure if the rest of the research team wants to say something about that. No. I see another question here from JP again. Just wondering if there's a North American network of Indigenous health COVID studies or something along those lines. So in our research team, our research team is big. We've kind of grouped off into people who study immigrants, people who study racialized groups, and people who study Indigenous peoples. And so at least on our team, we've been talking, along those lines for the last year. I don't know if there's a bigger movement or not. And I don't think Kira is on this call. So I can't ask her because she may know. But as far as I'm aware, we're one of the only research teams that's got at least a Mexico, US, Canada. Oh, Kira is awesome. Kira, can you help out? Because you know more about this than I do, actually.
Yeah, there has been some smaller groupings that are nation-based through different organizations. So we've had some groupings of family docs, Indigenous family docs, and Indigenous physicians that are also engaged in some research. We have, of course, some of the Indigenous health organizations, such as the First Nations Institute for Data Sovereignty. That's not the name of it, but led by Jonathan Dewar. In the US, there have been some health organizations that have done the same, including out of the Indigenous or the Data Sovereignty Network. But there hasn't been a tri-country collection like we have tried to do here, from what I can see. We've seen some collections of people doing Indigenous people in Australia and New Zealand, but not from within a North American context. I think we are the only one, if that helps out.
This hasn't really been a forum for us to gather, right? Like, I don't know a lot of newcomer forums that cover all three countries either, even though we're all facing similar problems and we're all attached to each other geographically.
Yeah, and it's while there have been a lot of groups that have gathered between the US and Canada historically in terms of research and activist organizations and such. But the having all three countries together, I've never seen a lot of movement in that direction. So I think that this is really quite unique, not only for Indigenous people, but also for other groups as well.
Thanks, Kira.
You're welcome. Good job, guys.
I don't know if there's other questions. I have to do this on my phone and it's a little bit hard to follow. But I'll take this opportunity to thank my colleagues, especially Maria, for her insightful comments and helping us out today. And also thanking the audience for their great participation in helping us try to understand, you know, the results of our data, but also where we can ask new questions as we move forward. And to welcome you to join the social impact network of the variants that we just announced this morning. We have really a short break between now and the third panel, which will start at 2:30 Eastern time, 1:30 Central time, 12:30 Mountain Daylight Time, and 11:30 Mountain Standard Time. So I think if I don't see other questions here, I think that we could probably safely conclude for today. If you, Avery, if you could pop up the slide on the contact information, just in case people are interested. It's our contact information. We have 2 websites of data that we'd love to share with you. And so both are available online. And I welcome any questions even after this event is over, because this is an ongoing study. So thank you very much to the panelists, to Maria. Thanks to the audience for giving us some great feedback and some ideas. And we'll take I guess a 19-minute break before we start the third round of panels, which are focused on, panel number 1 is focused on the impact of health and ethnicity on COVID amongst farm workers in the Baja California region of Mexico, a session on Asian Americans and Canadians' identity, attachment, and trust. And the third session with Dr. Ladner, who just spoke on the COVID-19 impacts on Indigenous peoples in Canada, the US, and Mexico. I welcome you to join us for the next panel and for tomorrow's session as well. So please do take a little stretch break, and we'll see you in, I guess now, 18 minutes.
Thanks. Bye.
Thank
Bye.
you.